Good morning, everyone. Thanks for being here. We appreciate your attendance. Since the COVID-19 virus was discovered in the United States, the Bonneville County Sheriff's Office and staff have been engaged with planning and implementation of safety and intake procedures at the Bonneville County Jail relating to the many variable ties to the spread of the virus. The CDC has published guidelines or guidance on the management of coronavirus disease 2019, COVID-19 in the correctional and detention facilities that medical staff and jail administration have been working hard to implement and follow. Deputies and medical staff under the direction of Dr. Jeff Keller have been working with Eastern Idaho Public Health to adapt appropriate intake, screening, and housing process inside the facility for all inmates. Last week, deputies identified an inmate reporting and showing symptoms of sickness and took steps to isolate that inmate away from the others in the housing unit. The inmate was tested for the COVID-19 virus and showed a positive result late last week. At that time, Eastern Idaho public health officials and medical staff determined all inmates in that housing unit would need testing. Procedures to keep that particular housing unit isolated and minimize contamination from other parts of the jail as much as possible were immediately implemented. The results in that housing unit returned to the Sheriff's Office administration last night late and indicated multiple inmates showing positive for COVID-19. Over the past few months, tests of multiple inmates who indicate possible exposure to persons with the virus or showing sickness of the symptoms related to COVID-19 virus have been performed according to protocol and in place producing negative results from those tests. Deputies and medical staff are continuing to monitor inmates, this particular housing unit, and appropriate treat and isolate it with preventative measures, minimize potential spread to other parts of the jail. At this time, most of those inmates are asymptomatic, if you will. The Bonneville County Jail has a staff of nearly 100 deputies and medical staff who have been diligent in performing their duties and taking care of inmates who come and go from our facilities. Sheriff's Office deputies and administration will continue to work with Eastern Idaho Public Health to maintain proper screening for anyone who enters the facility and follow CDC guidelines for COVID-19. Personally, I would like to give you a statement from me and advise the public who have family members in the Bonneville County Jail that the Sheriff's Office has made every effort to protect everyone inside the jail. Our facility is extremely well maintained and clean. We have professional medical staff led by Dr. Jeff Keller, a nationally recognized correctional medicine expert. We are well equipped to take care of inmates in our custody. The Bonneville County Jail adheres to all Idaho jail standards as well as nationally recognized jail standards. We are inspected by the Bonneville County Commissioners every quarter throughout the year and by the Idaho Sheriff's Association once a year for jail standards certification. The Bonneville County Jail is not like the rest of the community that those in custody do not get to take the day off and stay home when they are sick. They remain in custody and they are taken care of by medical staff at the jail, and we do not release inmates because they are sick. With that said, the jail is like a small city with the same issues that we all deal with as we move throughout our day. We will continue to monitor the inmates and staff to make sure that we are taking best care of those that are in custody and the deputies that maintain order in our jail. As the sheriff of Bonneville County, I am proud of the facility and staff at the jail and their dedication to and extremely hard duties they face with the day-to-day work that they conduct. They have endured and accomplished many things as we continue to work through the issues of this pandemic. Let's be real in what we're talking about. A jail is not the Marriott. It is a jail, but our jail is taken care of. We maintain it. We make sure that there's a medical staff there that take care of our inmates. And so all the false stuff that comes out about how bad it is needs to be put away, and know that the inmates in the Bonneville County Jail are well taken care of, that the Idaho Department of Correction inmates that are being housed here are well taken care of and medically taken care of. And anytime there's an issue, the Department of Corrections is notified, just as they were notified when we found out that we had some positive cases. The prison has positive cases, and they're taking care of their inmates. So I want to make it very clear that this is no different than the rest of the community. A virus spreads through the jail just like it spreads through a community, and we will maintain and monitor our inmates to make sure that people are safe and taken care of and medically taken care of. So, any questions?
So you mentioned that there's multiple cases. How many?
So, pods or housing units are like 42. This one happens to have about 35. 34 of those are testing positive in that housing unit. We have had staff that have tested positive and that were isolated and off work. I think we still have one out, but I think we've had 3 staff that have been tested positive.
And then are there extra measures that are taken now so that those staff don't contract it and take it home with them?
Correct. So everybody's wearing masks inside the facility. They are trying to do everything they can. They've been wearing masks for some time. They have been cleaning and doing all the precautions that they could. But at this time, each incident is taken care of per the guidelines throughout the facility. I do have Dr. Keller here with me, and also James Corbett from Department of Health with us here. And so we can answer other questions if you wish.
You mentioned, I mean, it's the jail, people are in closer quarters. Is it hard for you guys to maintain social distancing measures inside a jail, or is that something that you guys can do?
So let's look at the jail as a house, okay? So each housing unit is a house with 30 to 42 family members in that house. So they're all together, just as myself and my staff work together on a daily basis. They work, they sit together, they eat together, they socialize together in their little housing unit. So, yeah, they are close contact. There is no way that you can distance everyone in a jail. There is not that much room.
So is priority then now keeping that unit from spreading into other units?
Yeah, so I mean, they're all segregated, so they all have walls, they are all separated. We're not moving inmates from unit to unit. So the jail has been very meticulous about keeping track of who's in what housing unit. And so, and as they're going through. They go through on a 30-minute basis, basically, and they talk with the inmates and they check and see how people are doing and see how things are going. So they're monitoring what's going on in the pod or in the housing unit all the time. So there's communication, there's, they're looking at them, they're seeing how people are doing, if somebody's staying in bed, all of those things are, they're monitoring all of those. But we're not moving people from housing unit to a housing unit. Intake, they come in, they have a screening. They specifically, and I don't know that it was well reported before, a screening is not a test. A screening is questions, who you been around, how you feeling, all those certain questions, things that we would ask for. Have you had a fever? Have you been feeling sick? Have you had any of these symptoms? And then they go into a 14-day, not isolation, I don't want to use that. And it's not a real, they're not quarantined, segregated all by themselves. They are in a special area that we can monitor these guys coming in and making sure that they're doing okay. And then once that 14 days is up, then those inmates are placed in one of the housing units throughout the jail. We know exactly the day they went in, we know how many have gone in, and who's in which area. And then we don't move them around unless they're going to a separate single cell or something like that. So we don't move them from housing unit to housing unit.
So you mentioned most are asymptomatic, but is anybody required like hospitalization or anything like that?
Doc, do you want to answer some of those questions?
The answer to that is all of the inmates report as of this morning that they are asymptomatic.
Nobody's hospitalized.
Nobody's required hospitalization.
Is there kind of a general age range that this is impacting in the jail, or is it just a wide?
With the housing unit, it's in one housing unit only, and the age range of that housing unit is
Probably 20s.
20s up to maybe 40s, relatively young.
Will there be any follow-up testing on inmates in the other housing units?
Yes.
For you guys as the medical staff, what have you guys specifically done to prepare for something like this? Because it was coming, you guys were expecting it to come. What specifically have you had to do?
I'm going to point you again to the CDC guidelines for detention facilities that's published online, and that outlines in detail what we have tried to do. But basically, we've tried to prevent the entry of COVID into the jail by, as the sheriff said, not isolating, but keeping new inmates away from housing units for 14 days. We screen the staff daily. Once they come in, are you sick? Do you have a fever? We are requiring the staff to have personal protective gear, meaning masks at all times, unless they're alone. We have issued extra sanitation supplies and masks to all the inmates. The inmates are not required to wear the masks in the dorms, but they are required to wear the masks when they're outside the dorms, moving amongst when they go outside the dorm for whatever they need to go through. We have a very we coordinate all these efforts with Eastern Idaho Public Health. We do contact tracing with all positives. We have a very light touch on testing. We test just about anybody that has symptoms, and more. Everything that we're doing is in the CDC guidelines.
So what do you guys do, like if some inmate requests to be tested? Do they have to show the symptoms or what these tests that they ask?
If an inmate requests to be tested now, well, we would probably test them. But all of our decisions about who to test, who not to test, and when to test, we coordinate that with Eastern Idaho Public Health. The problem with doing too much testing is if you get a negative test, that's negative now, but it's not negative in a week or 2 weeks. So you try to do the testing properly and at the right time.
Sheriff, you said earlier 3 staff members had tested positive. When exactly were they, when did they test positive?
So I'm trying to remember how far back. So we had a sergeant test positive probably 3 to 4 weeks ago. He has just recently came back to work. We have one classification that is still out, and then we have 2 others? One other that's,
So 2 are still recovering?
yeah. So over the last month, I would say those have all come up. What we've tried to do is we want to stay within guidelines, so we're not testing unless showing symptoms. And they know that if they're coming to work and are showing symptoms, they don't show up. They just don't come into work. And then they're scheduled for tests. So they've tried to be very careful about, showing up at work or being around the jail. The jail has been very good about using their masks and making sure that we're taking best precautions. But even the best precautions, we still have it in our community. So we still have it in our jail, even with best precautions. So those are things that we're trying to, we'll try to mitigate. What did you tell me? It's 2/3 better to have a mask on. There's still a potential that you can get the virus without the mask, but it's better to have the mask on. So those preventative measures have been in there. James, do you have anything that you would like to add or share?
I'm happy to answer questions, but
I have one that would probably be applicable to you.
I have a couple of questions for the sheriff.
Okay.
So you mentioned that this housing unit holds 42 inmates,
Right.
and you said 34 out of 35 have tested positive. Have you tested 35 or?
Tested 35. So they hold 42, but it's not absolutely full, okay?
Okay.
It's management,
Perfect.
right?
So there's 35 there.
So there's 35 in there, 34 have tested positive.
And what are you doing as far as medical treatment for the ones that do test positive?
Nothing unless they need it. But there's no medical necessity. You may have it right now. I may have it right now. We don't know. We're not showing symptoms. They neither are showing symptoms, but if they do show symptoms, the one that was sick, he wasn't feeling well. He said, I'd like to see medical. He was taken down to medical. They checked him out, had some symptoms, so the doctor had him tested. He's separated from the rest, and he's getting medical necessity of whatever he needs. He's getting fluids, he's getting, all those things that they would do. That's probably over my head, as the doctor should be referring that. But, I mean, if you got the flu, if you're feeling sick, if you got a fever, they are taking care of those issues. The rest are not showing symptoms. They indicated that they have no symptoms right now.
Can I
Yes.
to that?
So this morning, when we announced to the pod that the ones in the pod that had the virus, we asked, does anyone have symptoms? The answer was no. Nobody in there had symptoms. We asked, is there anything that you all need or want? They asked for increased access to Tylenol and ibuprofen in case they had a headache or something, and that was given to them. We are going to check on them daily, though. If that changes, we'll know it within a day. We'll treat them according to standard medical therapy for COVID-19, which is what they call supportive. There's no antibiotic for it. There's no drug that, especially for someone with a mild case, that it needs to be given. It's supportive care, and we will give that as needed.
So the inmate who was not feeling well, who was initially tested, is he asymptomatic as well?
Yes, he wants to go back to the pod, and we'll probably let him go back because he's asymptomatic and says, I'm better. Can I get out of medical?
Has it been 14 days?
Since he's, no, the guideline is not 14 days per the health department. The guideline is 10 days, improved symptoms, no fever for 1 day. So if you meet all four of those, you can come back to work, go back to housing, whatever, as long as they meet that. And the one that tested positive previously meets all those now.
I have one more question. Is there staff that's moving in between the housing units? Because you mentioned that the inmates aren't moving from unit to unit, but are the staff?
So the staff is always moving from unit to unit. So again, everybody is checked every 30 minutes. So you got to realize it may be a jail, but it's not like isolation. There's movement for the staff to go from unit to unit, checking, talking with inmates, having conversation. You know, they have a chance to look and see how they're feeling. They, you know, if they're not looking like they're doing well, then the staff initiate the contact to medical and send the inmate to medical. So this is not isolation. This is, the inmate that we were talking about just now went out of the pod, he'll come back to the pod. Just like a family member is, you know, back to having dinner with the rest of the family. So yes, there are staff that are moving from place to place. We try to control that, make sure that they're washing, that they're wearing their mask, that they're doing the right things as they go throughout the building. Okay?
So this would be a public health question. So Eastern Idaho Public Health announced 31 cases last night in Bonneville County. Are these cases
No.
included in that total? Or?
No, these results were received after the announcement of cases from Bonneville County.
So these will be included in today's?
So they will be received today as long as we get the actual report. So these reports were, because of the nature of congregate living facilities, and they've alluded to that a few times, the CDC guidelines, we want to make sure that we act quickly and promptly. So those results were called from Idaho Bureau of Labs directly to the Bonneville County Sheriff's Office. So as Eastern Idaho Public Health receives the actual lab reports of those, they will be reported.
You mentioned it was, I think you said late last week that the first inmate tested, positive test came back. What day was that exactly?
Friday.
Friday.
And then you tested everyone that day?
We tested everybody else on Monday.
Were you able to, because I know it's been taking a while to test it sometimes, come back, were the tests able to be expedited or something?
Tests were done Monday, we got the report last night, and the next day in the evening.
So it was a one-day turnaround?
So another public health question, but with this, because these numbers will trickle into Bonneville County's total numbers, and they are still in that moderate risk.
Yes.
Will this impact potential changes to those risk levels?
Yeah.
For the general population, or because this is isolated out?
Yeah, this is isolated out. You certainly speak to that. So congregate living facilities specifically not long-term care, but jails or prisons are not counted in the active case rate for any of the counties where those individuals live.
How do you guys plan to keep those inmates, like, let's say some of them are being released soon or something, how do you keep them from spreading it back to their families once they're released from jail?
So we will make sure that medical knows who's up for release. And then at that point, we'll make a determination of how they'll be released and what they will, their guidelines that they will need to follow.
Will you potentially keep an inmate for a little bit longer until that 10 days?
No.
closes and their brief symptoms?
The order for release is the order for release. So unless the release says they're ready for release, but hold them for 10 days, we will not hold them for 10 days. Once the court gives us the release, then we will take appropriate action and make sure that we follow protocol from there with the doctor's approval and with public health's approval. We want to do it as systematically as we possibly can, so we're consistent in what we're doing and we're as safe as possible. We're not going to just send somebody back out into the community with symptoms. Okay?
Are you guys doing like facility to facility transfers at all with inmates right now?
Right now, we are not. So we've been talking with IDOC. IDOC just opened up their transport, and our first transport for IDOC was coming up this week. We've advised IDOC that we have had some positive tests. We are regrouping and determining what we're going to do. If we have IDOC inmates that are tested positive, we may send them that group of people, but we're not going to just, mix and match here. We're going to make sure that we have a population that needs to be moved, and if it needs to be moved, we'll try to keep that so that IDOC knows what they're receiving. And then they can take their protocols from the bus to whatever facility they want to house to. So as far as receiving inmates from other jails or whatever, we're trying not to do any of that. We don't, we're in cooperation with all the jails in southeast Idaho, and we do house inmates in other jails, and they house with us, but we're very careful on any of those that are happening. We haven't been doing those for some time. Anything else we can answer? You guys have been very good over here. Do you have questions for us? We're more than happy to answer questions for you.
Probably so.
Okay. But I absolutely want to stress that this is a professionally run facility. It is a well-maintained and clean facility. It is taken care of by professional detention officers that are certified and trained. They do a great job. They take good care of the people in our custody, and we will continue to do that through this. It's not going to be like mom taking care of you, when you got the flu. But we have a great medical staff that are professional, medical, certified medical staff, and they will take good care of our inmates that are in our custody. So that's where we're at. I want you guys to know up front that that's the situation, and that we are not going to just forget about somebody. They're all taken care of. We're all human beings. We are all there and respected, and we want to make sure that the people in our custody are taken care of. Okay? Thank you.